Why are doctors leaving South Africa, the land they were born and raised in? This is a question that has been echoed across the nation in recent years. A concerning trend has emerged as a significant number of South African doctors have started packing their bags and bidding farewell to their homeland. The reason? A combination of factors that have been brewing over time. The introduction of the National Healthcare Insurance Bill, or NHI, has been a major talking point. But it's not the only reason pushing these medical practitioners away. Reports, including a notable one from City Press, have highlighted other long-standing issues such as low salaries, poor working conditions, and lack of job security. A study published in the Human Resources for Health journal in 2019 found that, out of 497 medical graduates, only 444 were still practicing in South Africa. That's a significant exodus indeed. Let's delve deeper into the reasons behind this concerning trend. What is it that draws these medical professionals away from their homeland? It's a question that requires a deep dive into the personal experiences and motivations of these doctors. We've had the opportunity to speak with several who have embarked on this journey, seeking greener pastures beyond South African borders. One doctor we spoke to, let's call him Dr. Smith, expressed frustration with the low salaries in South Africa. He told us, "There's a stark disparity between the value of our work and the compensation we receive. Overseas, the pay scale reflects our skills and dedication more accurately." Then there's Dr. Patel, a young doctor who was disillusioned by the poor working conditions. She shared, "The lack of resources and infrastructural support made it difficult for me to provide the level of care I aspired to give. In other countries, healthcare systems are more robust, allowing doctors to focus on their practice rather than battling systemic issues." The story of Dr. Makiza is a tale of seeking job security. He told us, "In South Africa, the constant changes in health policies create an unstable environment. In contrast, other countries provide a more predictable career path for doctors." These stories echo a common narrative of doctors being pushed away by the inadequacies of the South African healthcare system. But it's not just about what's driving them away, it's also about what's pulling them towards other countries. The allure of better pay, improved working conditions, and stable careers in places like Canada, Australia, and the UK is strong. But it's important to note that these doctors aren't leaving out of lack of love for their homeland. In fact, it's quite the opposite. They're leaving because they want to be in a position where they can do their best work. And unfortunately for many, that place is no longer South Africa. While it's clear that these doctors are seeking better opportunities, what does this mean for South Africa? How does this exodus of doctors affect the healthcare system in South Africa? The impact is profound and far-reaching. South Africa's healthcare system is under tremendous strain. With each doctor who departs, the burden on those who remain amplifies, leading to longer working hours, less personal attention for patients, and inevitably, a decline in the quality of healthcare. Imagine a scale, with the country's medical needs on one side and the number of doctors on the other. With each doctor leaving, the scale tips further out of balance. This isn't just a matter of numbers, but a crisis of capacity. Fewer doctors mean fewer hands on deck to respond to emergencies, perform surgeries, and provide critical care. It means overworked remaining medical staff, who are stretched thin and pushed to their limits. Patients are left in the lurch, with fewer doctors to attend to their health needs. The waiting times for consultations and treatments grow longer. The doctor-patient relationship, vital for effective care, gets diluted. Patients may have less time with their doctors, and each doctor has less time for each patient. This could lead to misdiagnosis or delayed treatment, impacting patient outcomes negatively. The overall healthcare infrastructure also takes a hit. The departure of doctors is a significant blow to the country's health system's resilience. It weakens the system's ability to respond to health crises, including epidemics and pandemics. And let's not forget the impact on medical education. Fewer doctors mean fewer mentors for the next generation of medical professionals. Interviews with remaining doctors and healthcare administrators paint a grim picture. They speak of a system on the brink, of resources stretched thin, of the mounting frustration and helplessness as they watch their colleagues leave, and the pressure mounts on them. This is not just about the doctors leaving, it's about the people they leave behind. It's about a system struggling to provide adequate care, patients suffering from delayed or inadequate treatment, and a country grappling with a healthcare crisis that shows no signs of abating. The exodus of doctors from South Africa is a story of a nation's health at risk. So what can be done to halt this medical brain drain? Well, the solution isn't simple, but it begins with addressing the three primary concerns: improving working conditions, increasing salaries, and ensuring job security. Let's start with working conditions. Many doctors feel overwhelmed by the workload, the lack of resources, and the pressure of working in understaffed facilities. By investing in hospital infrastructure and ensuring that medical facilities are adequately staffed, we can create an environment where doctors feel supported and able to provide the best possible care. Next, we need to talk about salaries. It's no secret that doctors in South Africa are significantly underpaid compared to their international counterparts. To retain these highly skilled professionals, their compensation must reflect the intensity of their work and the years of study and training they've undergone. Lastly, job security. The introduction of the National Healthcare Insurance Bill has left many doctors feeling uncertain about their future. Clear communication about the implications of these policies and assurance of job security could go a long way in easing these concerns. We've heard from healthcare experts and policymakers, and they agree. These are the steps we need to take to encourage our doctors to stay. It's a complex issue, but one that we cannot afford to ignore. The future of South Africa's healthcare hinges on these crucial decisions. In conclusion, the exodus of doctors from South Africa is a multifaceted issue. It's not just about the prospect of the National Healthcare Insurance Bill, but also long-standing issues like low salaries, poor working conditions, and lack of job security. This departure is having a significant impact on the country's healthcare system. However, potential solutions are on the horizon. The challenge lies not only in keeping doctors in South Africa, but in creating a healthcare system where they want to stay.